welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. ACC-AHA guideline on the diagnosis and management of aortic disease. The American College of Cardiology and the American Heart Association have published a new guideline on the diagnosis and management of aortic disease, focusing on surgical intervention, considerations, consistent imaging practices, genetic and familial screenings, and the importance of a multidisciplinary aortic team. DAPA-Gliflozin clinically and cost-effective in patients with chronic kidney disease according to the DAPA-CKD trial. The burden of CKD or chronic kidney disease to both healthcare systems and patients is considerable. DAPA-Gliflozin, a sodium glucose cotransporter 2 inhibitor, was shown to be an efficacious treatment for CKD in the DAPA-Gliflozin and prevention of adverse outcomes in CKD, that is DAPA-CKD trial. A recent analysis in CJASN indicates that in patients eligible for the DAPA-CKD trial, DAPA-Gliflozin is not only effective from a clinical standpoint but also from a cost standpoint. Evidence found for substantial pre-symptomatic monkeypox transmission. A UK study published by the BMJ found evidence for substantial monkeypox transmission before symptoms appear or are detected, which is known as pre-symptomatic transmission. Transmission was detected up to a maximum of 4 days before the onset of symptoms, and the researchers estimate that more than half, that is 53% of transmission, occurred in this pre-symptomatic phase, meaning that many infections cannot be prevented by asking individuals to isolate after they notice their symptoms. Since the international outbreak of monkeypox in May 2022, more than 70,000 cases have been recorded globally, with just over 3,500 cases in the UK. Although case numbers are now declining, it's still important to understand the transmission dynamics of the virus. For example, how it spreads from one person to another and how quickly symptoms appear, to help inform policy decisions and future interventions. Morning blue light therapy improves symptoms in PTSD patients. People with post-traumatic stress disorder or PTSD experience better sleep, a reduction in the severity of PTSD symptoms, and more effective treatments after exposure to blue light therapy, according to a new study conducted by researchers in the University of Arizona College of Medicine, Tucson's Department of Psychiatry, and recently published in Frontiers in Behavioral Neuroscience. The influence of sleep disruption on PTSD symptom severity is well established. Those who seek treatment to allay their PTSD symptoms often face a vicious cycle where poor sleep interferes with the effectiveness of treatments, negating any lessening of symptoms, which in turn contributes to sleep disruptions. To reduce and eliminate the emotional impact of traumatic memories, the patient needs quality sleep to integrate healing mechanisms achieved through cognitive or exposure therapy treatments. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.